I certainly have seen an increase in all types of abuse across the board. What I see is that people that were experiencing abuse previous to COVID-19, now it seems like those situations have increased, become more dangerous, and we're seeing that not only with domestic violence, but childhood sexual assault or human trafficking. Sexual assault, intimate partner violence, all sorts of ways in which we see vulnerable populations are even more vulnerable at this time. If you think about economic abuse as it is, it's a form of an abuse where one person is controlling the finances of a family, and oftentimes the person that's being abused, their finances are restricted. They're not allowed to work, or if they are working, perhaps their money is taken from them right away. I've worked with individuals who said, I raised 5 children, taking care of all of their basic needs on $50 a week. Pretty resourceful, pretty amazing. And now when you look at a situation where many people are unemployed, many people don't have any kind of income coming in, you're going to see those stressors increase. And when you see stress increase, you're going to see increased instances of abuse, whether it's economic, whether it's physical. It all kind of just bubbles up, and at times you'll see it come out in many different ways. Many things that I've done is I've done safety planning over the phone with people who have called in to our clinic, and we've talked about, having a cell phone if that's possible, or if you have an old cell phone, those will call 911 always, as long as it can turn on and it has power. So I'll talk to people about having, maybe a couple cell phones hidden around the home if they need to. I'll also talk to them about trying to connect, if possible, with a support person. As we're seeing now, people are more isolated. So that might be in a virtual way if that's possible, FaceTime or different ways to reach out if that's a safe thing to do. Also having a getaway bag packed or an exit strategy is something that's really important. If you're able to talk to your neighbors and let them know what's going on, perhaps they can help you. I've had people develop a code with their neighbor, like if they've called them and said, hey, I need maybe a cup of sugar or something, that's their plan, and their cue to call 911 maybe. Also, when you're getting ready to leave, packing those essential things if you need to leave, making sure you have your medications, making sure you have that important documentation that you might need to get into a shelter, perhaps, like your ID or birth certificate or those important documents. Of course, having a few basic things like clothing and toothbrush and that thing, if you can. But those other important items that you would want to think about is maybe an extra set of keys to get out or to get into the car, like those kinds of things are important for safety planning. If you know they have a history or even just a current situation going on, is be there to listen to them. Don't give them an ultimatum of, if you don't leave them, I can't support you any longer. That's even isolating that person further. Let them know that you're a safe person. If possible, in these situations, in this situation, if we're able to offer them a safe place to stay with their shelter in place, you could do that. That'd be a great thing, because sometimes people don't necessarily feel safe going to an emergency shelter for help, and maybe their support person would be a better option for them. Be available to them to listen ultimately, and try to be creative and safe about how you can do that. Oftentimes when we're in a situation in an abusive situation and you're isolated, it may not be safe for them to necessarily talk to you on the phone or something else, but maybe there's a different way you can figure that out with them. But trust that person knows what's safest for them as well.